Well, just when it looked like there was going to be a breakthrough on the healthcare battle, the whole thing looks like it's starting to unravel. Oh, my gavel. Earlier today, Tennessee Republican Senator Lamar Alexander and Washington Democratic Senator Patty Murray introduced their bipartisan healthcare proposal on the Senate floor. Unfortunately, President Trump has changed his stance from yay to nay, tweeting, "I'm supportive of Lamar as a person and also of the process, but I can never support bailing out insurance companies who have made fortune with Obamacare." A fortune. There you go. Now, just one day before, the president had expressed public support, calling the joint proposal a very good solution. This is confusing. Now, meanwhile, Trump's decision to end subsidy payments to insurance companies to cover the cost of deductibles for low-income Americans has already led a number of insurers to hike premiums. What a surprise. They were going to do that anyways, even if they didn't get a big handout. So will the bipartisan Senate plan survive the president's criticism? Let me bring in Hadley Heath. She is the director of policy at the Independent Women's Forum. Hadley, welcome back.
Thanks for having me.
So let's talk about this a little bit, because Patty Murray and Lamar Alexander come up with their big bipartisan solution, which, of course, is another big government plan that's another form of corporate welfare that just gives billions to the insurance companies that they'll pocket with glee. Why would we expect a different outcome from this?
Yeah, I think a lot of Americans hear bipartisan and they think, ooh, that's good, they're working together. But like any legislative compromise, the devil is always in the details. And as we learn more details about this proposal, it's clear what the Democrats are getting. They are getting those subsidies, those cost-sharing reductions that President Trump just halted. They're getting those legitimately. They're getting, finally, the congressional appropriations that those never got. It's less clear what Republicans would be getting out of this deal. There's talk about state flexibility, but we know that Democrats aren't going to budge.
Yeah, but what does that mean?
Exactly.
I mean, does that mean that I'll be able to buy an insurance policy from a state where it's less expensive and we'll see some free market flourishing and some competitive pricing? What does state flexibility mean? That it drives me crazy, because, as you point out, it's one of those vague phrases that could have absolutely no meaning attached to it.
And during the summer, we saw state flexibility as a major theme in a lot of those GOP repeal and replace proposals. But in those cases, what it meant was that states could, for example, get waivers from the essential health benefits. That's the package of federally required features in insurance plans that has actually contributed to higher premiums. And a lot of Democrats will admit that that's the case. So if we're looking at solutions that increase the choices consumers have and decrease those premium costs, I think we have to talk about those essential health benefits and some of the other regulations that have made these ACA plans so expensive. And we know Democrats aren't going to go there.
Yeah, and it's made it more expensive. And, you know, by forcing people to buy insurance they don't need, what they're doing is forcing healthy people to buy insurance they don't need to prop up the system for less healthy people, so they pay the same price for the same thing, although they have vastly different uses for all of it. And when the government engages in this kind of price fixing, you know, it turns into a socialist system that cannibalizes and implodes on itself. That's what we're seeing. So where do we go from here? I guess that's the ultimate question. Where do Lamar Alexander and Patty Murray go from here?
Well, you're right that the central planning in healthcare has changed the game for insurance companies. Instead of thinking about how to serve consumers best, they're thinking about how can we get more milk from this cow? How can we get more of these subsidies back in place? And some of the wise insurance companies already baked this into the cake. They knew that President Trump could stop these subsidies. Maybe they were paying attention when a federal court actually ruled them unconstitutional earlier this year. But the insurers that didn't count on that are in a bad place now, because they were counting on those illegal subsidies. That was their mistake, and now they're going to pay the price.
Yeah, and unfortunately, we're the ones who pay the price. But even with those subsidies, there's no guarantee that the insurance companies would pass the savings on to low-income Americans. All they're doing is, you know, they're boosting their own bottom lines, and it's very unfortunate. And until we get government out of healthcare, you're going to see more and more messes like this that are impossible to clean up, no matter how many people on both sides of the aisle are working together. Hadley, thank you so much for your insight. I always appreciate it.